Africa has announced it will resume its vaccination rollout with the Johnson & Johnson vaccine following a temporary suspension for a possible link between the injection and blood clots. Now, the one-shot vaccine will be administered again starting from Wednesday. Joining me now to talk about this is President of the Southern African Society for Thrombosis and Hemostasis, Professor Barry Jacobson. Prof, good evening and thank you very much for your time. There is clotting risk. It is rare, but it is serious, especially for women in their 30s. That's what some of the research is revealing. What do we do with that information?
So thank you very much. Thank you. I think that the important point to note is that thrombosis is a very common disease. And if we're going to vaccinate millions of people, then we're going to find that this common disease is going to be found. The actual true cases which was described of the so-called VITT, which is vaccine associated with thrombocytopenia, which is a low platelet count, and thrombosis, which is clotting, is actually very, very rare. It occurs in 1 in a million people, which means you have more risk of being struck by lightning twice. The big concern is that the public are going to be scared to be going back to be vaccinated. And my appeal to the public and to your viewers is that being vaccinated is critically important, as one can see what is happening with the disaster currently in India. Being vaccinated is a major, major weapon that we as doctors have to try and alleviate some of this potential COVID disaster that we are facing.
Right.
So that is the problem. We're not saying that thrombosis won't occur. We are embarking on a study with Johnson & Johnson to look at, because there will be some cases of thrombosis occurring.
Yes.
This is a very rare condition.
Yes.
We know how to treat it. And I think that we should try and ensure that your listeners, your viewers, understand that they need to register for the vaccination program and to be vaccinated as soon as possible. The Sisonke trial, which was for healthcare workers, and we've only vaccinated about half our healthcare workers, is being started again tomorrow, depending on some of the ethics committees. But I know for a fact that some of the sites are reopening tomorrow, which is amazing. Now that we've got it back on track, and I think that's a tribute to the hard work put in by Glenda Gray and her team to ensure that that they addressed all the concerns that SAHPRA had, and to address them as effectively and as efficiently as they did.
Yeah.
And I take my hat off to her. She did a wonderful job, her and her entire team.
Now, for countries with resources like the United States, they're saying, well, part of handling those fears and that skepticism would be the patient and provider awareness that would need to be conducted. But second leg to that would be the availability of other vaccines. Now, unfortunately, in South Africa, we don't have that option of other vaccines at this particular point in time.
That's a very, very important point that you bring up. In South Africa, we don't have any other vaccines, and the Sisonke is actually a trial. But the other important point is that the AstraZeneca vaccine doesn't appear to work against our variant. And we're not sure about the Pfizer. We know that the J&J does seem to have a good thing, and it's only a single injection, which is also critical for us, because logistically it's very difficult to vaccinate so many million people and to get them back for a second vaccination in a country with limited resources like we've got is going to be a huge logistic challenge. So the fact that only one injection is required for the J&J is a huge advantage. And I think that's a critical issue that we need to be aware of and to explain to your viewers that this is a vital thing, that they go and register as soon as possible and get vaccinated as soon as possible. And the risk of thrombosis, sure, there is a risk of with anything. There's no free lunches in medicine. In medicine, there's always a risk-benefit ratio. But vaccination, in our setting, the benefit far, far outweighs the risk.
Right. Have we updated our communication then on this going forward? What is the conditions that SAHPRA has put in place for us to continue with the vaccination?
Well, they wanted a contingency plan of how we would manage it. So the society with help from overseas guests, actually, experts, have put out a document stating how to diagnose it and how to treat it. And we are informing all the doctors. It's been published in the South African Medical Journal across specialties. And so we have addressed that concern.
Right.
And we are closely monitoring every case that does present with a thrombosis to see is it linked or not linked. Because don't forget that, as I said previously, that there's a lot of patients out there that if you vaccinate enough people, some of them are going to get clots.
Yes.
But some of them will get clots even if you didn't vaccinate them.
Yes.
And that's the critical issue, to try and show a link between those where the vaccine is causing the clotting. Because it is the commonest cause of death. If you look at strokes, heart attacks, pulmonary emboli with deep vein thrombosis combined form of thrombosis or blood clots.
Yeah.
That is the commonest cause of death worldwide. So there's going to be a background cause. And the very important point to remember is COVID causes blood clots. And I've treated and had patients die on me who developed clots from COVID.
Yeah.
So I think that people need to remember that COVID is on its own right is a huge, huge cause of blood clots. And vaccinating and preventing COVID will be a long way. So people say, I'm scared of getting a clot. They should be more scared of getting the clot from COVID than they should be from the vaccine. Excuse me. And I think that's the critical issue that we need to address.
What is the usual treatment then that you use for blood clots? There are some advising against the use of heparin.
Yes, so we normally use heparin for blood clots, and it's very astute of you to note that for vaccine-induced thrombotic thrombocytopenia, which is very, very rare, we don't use heparin. We actually advise against the use of heparin, and we use artificial kind of heparin called fondaparinux or Arixtra, and we also use novel oral anticoagulant therapies such as rivaroxaban or Xarelto, which we then monitor and treat the patients. So it's very astute that you noted that, but it's only in those very rare conditions where the patients have got a low platelet count with the thrombosis that we would use alternate forms of medication.
Should we have stopped and reflected and interrogated a little bit? Was it a good move?
I think that the problem was that SAHPRA, their hand was forced by the fact that FDA stopped. So they were damned if they did and damned if they didn't. So I think that the minister and SAHPRA were put in a very invidious position by the fact that the Americans had stopped. And therefore they felt if they didn't carry it on that they might be seen to be cavalier. But they did stop, but I think the important point was to get them started as soon as possible. And I think that the Sisonke team, and that's Glenda Gray, I've said before, and Ian Zonner, have done an amazing job to try and allay their fears and to get Cabinet to start again as soon as possible.
Looking at the situation, you already mentioned, what we are seeing happening in India. What do we need to do now, to at least up our level of inoculation? Of course, that depends on the stock that we have available, but the type of work that we now need to put in place, at least to catch up to what the rest of the world is doing.
Well, I think that we're doing as much as we can. I think logistically in a country like South Africa, it's going to be very difficult to get to everyone. And I think that the team doing it, I'm very impressed with them, the way they are going about it. And I think that they are doing it responsibly with an out of stock coming into the country. And I think they're doing everything they can at the moment, to be quite honest. I think that that's the critical issue. I think the other point is that we need to remain vigilant, that we need to understand that COVID is out there. And even though we're at level 1.5, whatever you want to call it, what level we're at, but we need to be vigilant and we need to take it seriously that COVID is a terrible disease and it hasn't gone away. And the fact that the numbers are low, we've seen the numbers start to increase now, and that is very worrying.
Prof. Jacobson, I appreciate your time. Thank you very much for joining us tonight here on the Newsfeed Late Night. That is the president of the Southern African Society for Thrombosis and Hemostasis. That's Professor Barry Jacobson. We continue next here on the Newsfeed Late Night.